Have you ever felt full just after a few bites? Or had ongoing indigestion that just won't go away? Most of us brush it off thinking it's gas, acidity, or stress. But what if your stomach is trying to tell you something more serious, like stomach cancer? In this video, let's talk about the symptoms of stomach cancer, especially the ones we often miss in the early stages. So first, what is stomach cancer? Also known as gastric cancer, it happens when abnormal cells start growing in the lining of the stomach. It usually starts silently, without any major signs in the beginning. That's why knowing the subtle early symptoms can actually save lives. Let's start with the early symptoms, the ones that often get ignored. Feeling full too soon. If you feel bloated even after a small meal regularly, that's not normal. Next is persistent indigestion, or heartburn. If you're popping antacids often and it still doesn't help, it's worth checking. Next, loss of appetite. You're just not hungry anymore, not trying to diet but still skipping meals. This is not just mood-related, this can signal a deeper issue. You may feel mild nausea, not because of food or infection, but just this constant, uneasy feeling. Check unexplained weight loss. If you're losing weight without trying, that's always a red flag. Now let's talk about some advanced symptoms, the ones that usually show up when the cancer has started growing more. For example, you might start getting stomach pain. Not sharp, but a dull, constant ache that often feels worse after eating. Then there's vomiting, and in some cases, it might even be mixed with blood. That's a serious red flag and should never be ignored. Another thing to watch for is black or tarry stools. That can actually mean there's bleeding going on inside your stomach. You may also feel extremely tired all the time, and that's usually because of internal bleeding causing iron deficiency or even anemia. And if the cancer is near the top part of the stomach, it can make swallowing difficult or painful. So if you're struggling to swallow food, that's not something to take lightly. Now you might be thinking, who's at risk? Well, you're at higher risk if you're over 50, have a history of H. pylori infection, smoke or drink alcohol regularly, have a family history of gastric cancer, or if your diet includes a lot of salty, smoked, or preserved foods. But here's the good news. Stomach cancer is treatable, especially if detected early, so don't ignore the signs. If you've had ongoing symptoms like these for more than 2 to 3 weeks, get checked. A simple test could make a huge difference. Thanks for watching. If this helped you, don't forget to like and share. See you in the next video.